What can I do to fix my hollow eye bags? I'm 27 years old, and my hollow eye bags have gotten worse as years go by, especially since I became a mom. Wish they would be dark only, but the hollowness makes me feel a lot older. What is the best option to fix them? I'm looking for a smooth, tight, totally hollowless and clear area. If fillers are the best option, how much milliliters would I need? Thank you.
Thank you for your question. You're 27 years old and you've submitted multiple views and photos of your eyes as well as part of your face, and you're stating that your hollowness under your eyes has gotten considerably worse, particularly after you became a mom. And you want to know how you can improve these areas with various descriptors about tightness and hollowness and how many milliliters of fillers may be necessary to help you. Well, I can certainly share with you how I approach patients like yourself in my practice and counsel them about a strategy that can hopefully be a practical and sustainable. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with the under eye area as well as the cheeks has been a central part of my practice for this time, and certainly we live in a time when there are a lot of exciting options that give us more tools to help people like yourself. So in a situation like yours, very often I would speak to a patient who is young like you, who has these concerns, and just as part of the analysis, I'd want to see what they looked like before they gave birth. And there is an observation that has been made in our field, and it was particularly brought to my attention years ago by a very highly respected dermatologist, and she had stated that women lose a lot of facial fat with every subsequent pregnancy, and she was very much an advocate for fat grafting. There may be a lot of other variables that we can probably should be studied. Certainly as we get older, we also lose facial fat and there is volume changes. But since you are young, I would not focus on aging related changes, but more of just how much volume was there before and how much is there after. And also, lifestyle is an important factor. I think that anyone who, especially mothers with these responsibilities, will often be fairly tired. It's part of normal the realities of parenthood that we all know. That has, of course, an effect on weight, and physical weight has often an impact on facial volume. Now, that being said, we can now focus on what I would see just based on the photos. When I look at your eyes, I also have noticed, especially on your 3/4 view, that there's a relative deficit in the area of the cheek. And one of the concerns that I would have is if you wanted to identify and treat a limited area of hollowness under the eyes, you certainly can use a hyaluronic acid filler such as Restylane in this area, and you can try to enhance some of the transition between the areas of projection versus the area of hollowness. The challenge that I find in this particular area, and in terms of getting the overall aesthetic, is that if someone has very flat and shallow cheeks, then the relative improvement is not quite as dramatic. What I would often advise my patients is to think of, when they look at their eyes, think of the eyes in relationship with the cheeks. The eye to cheek relationship is very, very important. A lot of times when people feel like their eyes are hollow, they don't even think that their cheek volume is contributing to that. Often you lose the forest for the trees by looking so closely in one area. We do a procedure called structural volumizing, where we place the volume that is either in the deficit, that is more of a genetic issue, such as in a younger person, or loss related to aging due to bone loss and facial fat volume loss as we get older. But nonetheless, it's a unique approach where the filler is placed between the bone and the muscles. By doing that, you restore in a very natural way those areas of deficit. Now, in terms of the balance, it really creates what I feel is a more natural harmony between the eyes and the cheek. A lot of times people will say that they've always had these hollow-looking eyes, but then after certain life events, whether it's childbirth, whether it's moving to America, whether it is weight loss, whether it's new jobs, various things they'll often associate and connect and say that they've looked more tired. So I think that you should keep an open mind about the relationship of the eyes and the cheeks. And as far as the volumes of fillers are concerned, you're looking at anywhere from a single syringe for the under eye area, which probably is on the conservative side, which is 1 milliliter, to a few syringes to include the cheek area. And I think that's best really determined by a physical examination. So I'd say meet with qualified, experienced cosmetic doctors who you feel comfortable with, and also get the opportunity, make sure to review your photos of what you look like before and after, so you can get a sense of what kind of look looks right for you. A lot of times patients are afraid of being overfilled and overplumped, with good reason, because they see so many celebrities who look overfilled and overplumped. But I think that when we try to focus on what is natural for the person, then that's retaining character. And this is what I would say most of the people who come to me really want as an outcome. So I hope that was helpful. I wish you the best of luck. Thank you for your question.